Alright everyone, so we should have got the devoted onboarding instructions if you're with Plan Advisors. If you're not with Plan Advisors and you'd like to be, or you're just looking to how to contract with Devoted and you haven't already, you can let me know. If not, you can watch this video and find out how to do it. And also there is a user guide for reference. I'll go ahead and link that as well for those of you folks who want the step-by-step instructions from them. But this will just be kind of a walkthrough on how it actually looks. So we're going to click on that, create an account. So for most of you folks, you should have already created an account with Devoted. It's loading up. I'm going to show you that window here. Okay. So you click here and then it'll actually take you to like a registration page. I accidentally filled it all out and didn't have to, because after I clicked in next, it prompted me with this window here. I just put submit and someone already had it, so please log in your account, and then bingo, I was with the login page. So if you just type in agent.devoted.com/login, it should take you there, and that's it. My username was my NPN number and password already saved and logged in, and bingo, we are finally logged in. There we go. So let's get started. Put in your address. I usually click no to alerts and things because I honestly don't, I wouldn't read it anyway. I speak English. They don't have Japanese here, but you know what? I don't want to say that I speak Japanese. And here we're going to fill out all these things here. So most likely, I am not going to come back on the screen until I find something that is non-individual. So I'm not going to show you folks my W-9 form and stuff like that. But I may come back on a few of these. So let's see first what this thing's all about. Right here under the preferred markets, number 4, just type in whether you do field and telephonically, either or both, and then the states that you plan to sell. I plan doing Hawaii and Texas most likely, and my primary market is going to be in Honolulu. Go ahead and press continue, and let's go into this one. So here I'm just going to say that they have tell us about your selling needs. I'm not sure what this will actually entail, like if they'll give us anything, but for you folks, please fill this out as you as truthfully as you can. For example, I started selling Medicare in 2014. I get my leads from referrals. Which provider do you usually work closely with? I'm going to put none because I actually don't. Sales goals, you have this coming year. Well, overall sales goals, I'm hoping to get 50, but that's not all from Devoted. And I guess best support, I like operational help, so I probably will say things like, I would like to be able to see my clients' information so that I am able to assist with claims, billing issues, inquiries, I guess. Billing inquiries, and be a point of contact servicing agent. It's usually what I like to do. A lot of companies don't allow us to even touch really the client's things, but I don't think that that's I don't think that's a good thing. I think we should be right at it with the clients when they have things that we can at least assist with, or at least provide some kind of a status update at the very least. And a lot of times we don't. I have no idea what's going on with my clients, even though I have access to their demographic information. I have no idea if they're after the application is done, I have no idea whether or not they're getting care, or they have claims going on, or they have issues. I would like to have somewhat of an idea about those things, just so that I can help them out. I'm going to hit continue, and it's a code of conduct. So we're going to probably get out right over here, because this is nothing really that you need to see me go with. Alright, so here it looks like we will have to upload our certificate. So if you haven't downloaded your certificate, you would need to do that now. Download it and then upload it to the upload site here. And that's what I'm going to do on my other screen. I'm going to actually go ahead and get my AHIP certificate. For those of you who don't know where to get your AHIP certificate, let's go ahead and show us that. Alright, so we're in the AHIP site. You're going to need to go to transcript and hang on. We're going to go to My Certifications. And then here is certificate, AHIP Medicare certification, and you should have a certificate there. So go ahead and download that. Make sure you remember where you downloaded it to. And then of course go ahead back here and upload it. Oh, I guess I can't do it that way. There we go. Open. There it is. Continue. And now we have the training. So let's go ahead and do the training, and then I'll be back when it's over.
If you're asked why do you want self-voting, well, I'm comfortable enough with it that I'm on it, my wife's on it, my friends are on it, and they didn't get there by accident. They got there because I put them there. Hello, everybody. We're so incredibly excited to partner with you to bring the love and care that is devoted to many, many more people this year. Hello, I'm Ed Park, co-founder and CEO of Devoted Health, and I just wanted to give you a very warm welcome to the Devoted family. We've had an amazing past year, and a lot of you have been part of that, and I just want to thank you from the bottom of my heart for being part of our success. All of your input has been so valuable to us, and we've listened to all of it to create what is the fastest growing Medicare Advantage plan in the country. And for those of you who are new to us, we look forward to collaborating with you. Winning for us means we're taking care of our members, right? In ways that no one ever before has, but in ways that they long deserved, and we're here for them. And what they're doing now is so revolutionary compared to their competitors. Here's 11 plans. Which one to fit you the best is my first job. But I'd like for you to be on the Devoted plan because I know I don't have any problems downstream. What's most gratifying to us about the broker community is the way you've welcomed all of us. And you've given us feedback, and we have heard that and acted upon that. But more to the point, many of you have gotten to know us. I've talked with many of you who put your own families onto Devoted, and that just means the world to us. It's an incredibly sacred responsibility and obligation, and we think that it's really important that we live up to your trust. We're so incredibly proud here at Devoted to have built with all of our heart and soul a health plan that truly cares for everyone like they're literally our family. Everyone is busy working, understanding the connectivity, understanding the mission, the totality of what we're trying to do, and those kind of interactions feed into that, promote that, so that everybody not only knows each other, knows what people are doing, and understands why we're doing these things together in support of the Devoted mission to take care of our members, provide them the right healthcare, the right place, at the right time. We're so excited to have this opportunity to partner with you. Your opinions, your perspectives, your insights mean the world to us. We take that feedback and we put it into our products, into our mission, our vision, so that we can collectively help take care of our members. With fantastic benefits, spectacular service, and a culture of maniacal, passionate focus on treating each and every client of yours like our own mother, father, sister, brother, daughter, and son. Thank you so much for teaming up with us. May the force be with us. God bless us as we bring Devoted to everyone. Thank you so much.
I actually rather enjoyed that. Alright, next. It looks like the way they do it is the Humana way. Alright. Another video.
Hello and welcome.
Ooh, it's not happening.
In the rest of this training, we will be reviewing the following information. We will start with the Devoted difference. We will then review our coverage area and plan designs. Then we will put it all together with our sales process, tools, and events. Once you have reviewed the training, you will be directed to complete an exam in which you will need to pass with a score of 85% or higher.
Oh, that's
In
good.
reviewing the Devoted difference, it starts with our mission. We started with a simple question. Is healthcare today confusing, expensive, impersonal, really the best we can do? We knew we could do better. So we are here to dramatically improve the health and well-being of older Americans by caring for every person like family. This diagram outlines how we deliver our mission and our vision. We focus on our mission by caring for members like family. We build technology with a purpose to know our members more and be able to provide all-in-one solutions that deliver the right care at the right time. With this information, we look to improve health and well-being while lowering costs and continuing our expansion of products and location to serve more people. Through all of this, our vision is to make living a longer, better life possible for everyone. With Devoted Health, our members get all-in-one healthcare, complete with members' doctors, exclusive medical teams, and affordable health plans. The plans are coordinated to make sure the services help manage and bring together the pieces of care and coverage for our members and are customized to make sure care is tailored to our members' health and well-being. Following this video in the next few slides, you will be able to read more on how we are able to make all of this happen with our 5 core ingredients.
Alright, let's go down, find those 5 core ingredients. Voted plans. Alright, value-based, of course. Low administrative friction. Alright, that's what I want. Low administrative friction. Less PAs, please. Alright, I'm assuming we're gonna have to go divided guides. Alright, let's see what this customer service team.
We're going to show you how Devoted
We'll
Health
try
is
1 minute.
changing Medicare Advantage for members and for brokers. You'll want to hear this. As a Medicare broker, we know you're working hard to find your clients the perfect plan. But when they have questions, you're the first they call. If health plans are a maze of confusion at all times, that just means more of a burden on you. The big companies out there, I've tried working with them before for 26 years. They're slow. Basically, folks are lost. Well, good news here. Devoted Health is set out to change all of this for good. How? By investing in a uniquely personal customer service team that focuses on easy accessibility to all members and brokers, helping e-commerce get the right care, right place, right time. It's not that complicated, but it's sure hard to find. We call it the Devoted Guide Team, and they're built on 3 things. No robots answering the phone, all questions welcome, and their only metric is to solve your problem. This leaves brokers with happy clients and more time to grow their business. Sounding good?
Well, now all you're doing is spending your time getting new clients.
Yeah, like he said. Let's take a look at this revolutionary Devoted Guide Team. First order, no automation. Did you know Devoted Health Guide Team answers 80% of its calls with a real person in under 30 seconds? It's no wonder why Devoted Health's Net Promoter Score is 83%, while the industry standard is only 15. We are brutally realistic, and we just tell it as it is. Second, the guide to work with specialists, nurses, and doctors to answer any question under the sun. Setting up transportation? Check. Walk through benefits? Done. Finding the perfect specialist? Always. It's no wonder why members call Devoted 4 times more than the yearly average. We think that's because members are learning to love their insurance. That could be a first.
I'm selling something that you're going to be happy with today, tomorrow, next year.
Finally, they specifically removed time limits from phone calls. Devoted's only metric is getting the job done. And it shows 85 to 90% of first calls end in a resolution. Can you name another insurance plan that does that?
They want to serve the Medicare population in a way that hasn't been done.
Look, it's not rocket science, but Devoted Health has revolutionized the industry with their Devoted Guide Team. This is customer service that's accessible and easy, and now brokers can fill their book of business with more happy clients. So let's work together and get Medicare beneficiaries a plan that they will use and love. We look forward to working with you at Devoted Health.
You know, I'm just gonna say after watching this, it's pretty interesting if they can actually do this. I know a lot of these companies make these kinds of promises and don't live up to it. So it'd be great to see if they can. Like, a lot of times, this is just a tangent here, but it's a relevant one. A lot of times, it's really good to have just like a plan, like an insurance plan, or just helpful, you know, insight as to who's a good specialist, you know, who's a good provider to go to, which office is nice, you know, those types of things which you really don't get without you know, people who are working this 24 hours, or not 24 hours, like 40 hours a week, you know, that they haven't devoted their life or their career to it. And it's really hard. I'll give you an example. Like when I'm trying to find, you know, the next, or I went to the doctor last week. I got a referral to an ENT, an ears, nose, throat doctor, due to my allergies and my migraines, which are ultimately aggravated by my allergies. Anyhow, I would have no idea who to go and see, right? Fortunately, I'm in a health plan that owns the hospital system, so they can easily just go ahead and push me to the next available opening. Because really, I have no idea who to go to. My main thing is time. You know, I want to see it as soon as possible. So the provider with the next open availability, that's what I'm going to check out. But when you have no network really of, I guess, constriction, it makes it difficult to find a doctor because you have a whole slew of doctors to choose from, which can be a good thing but also a negative. So if they can actually live up to these promises, which I hope they do, it'll be good. It'll be a good thing. We'll see though. I'm always skeptical. All right, so they're in Massachusetts. They have call centers in Maine and Arizona, so they're pretty good with time differences. We have the East Coast and Mountain Time. We have staff that speak English, Spanish, and Creole. I guess that's okay. And of course, they have translator services. Let's keep going down here. Let's see, navigators. Remember calls. We can help, I hope. Alright, so the guide, apparently, whatever that means, I guess it's this person on the phone. Psychiatric referrals, calls to the office, and prescription refills. That's pretty good. Next section. I guess that's the same question here, so we have to go down, I guess. Alright, there we go. Problem solvers. Mistaken bill. I hope so. Alright, so this is something that I just recently dealt with. I had a client who got a bill over 2 years old, this bill. Well, I guess not over 2 years, about a year and a half old, but it was from 2020 and we are in 2022. I sent the claim issue over to the insurance company, and they just told me that it looks good to us based on the co-pays and you know, the plan that the member's on. Plan owes this much. I would have much rather have them kind of help a little bit more with, you know, maybe confirming, because the client does think that they may have paid some already. You know, maybe this kind of walkthrough would be good if, you know, Devoted actually offers. I don't know. Like I said, I don't know. We can hope, but I don't know. All right, so now we're complete. Go to next session. I guess we're gonna keep going down. So guides really care. So I'm assuming the guides are there. They must be the phone call center people. All right, this is probably good to keep on. So for those of you who are with Plan Advisors, please make sure you know this email and you know this phone number so you can call if you have any questions for yourself. Yeah, that's pretty good. Okay, let's go continue. All right.
Now that you have learned more about how Devoted is operating to be different, here are some statistics we are proud to share of our current success. Devoted is proud of what we have been able to accomplish so far, and we will continue to pursue success through the love and dedication that is in our hearts. Many of you may interact with our agent support. Here are some ways we have been able to help our agents so far. 95% of our calls are answered within 30 seconds or less, and we actually solve your problems. 95% of issues are resolved on that call. If your issue cannot be solved on that first call, 97% are resolved within 5 business days. We like to ask our brokers how our agent support is doing as well, and this year, most of our agents say we are doing great, with a 4.4 out of 5-star rating. We also offer bilingual support should you want to speak to one of our representatives in another language. For our members, we answer 87% of their calls within 30 seconds or less. Try it. Give us a call. We also help resolve their issues 91% of the time on their first call, and 97% of issues are resolved within 5 days. We also offer bilingual support to our members. For 2022, we received our first star rating, and we obtained 4.5 stars out of 5 as our overall rating in Florida and Texas.
Wow.
Only 5% of new plans are able to do this in their first year. In our other markets, we are still too new to be rated. We will receive our next star rating in October 2022 for 2023 plan year. Additionally, we are proud of our Net Promoter Score, or NPS, which is a scoring method that identifies how likely an individual is to recommend a product to their friends or family. Devoted Health has an NPS of 77, which is in line with some of the most respected companies like Starbucks and Netflix, and higher than the insurance industry average. Additionally, not only do our members say they would recommend someone to Devoted, but in a recent member survey, 62% of our members have actually said they have referred someone to Devoted. Thank you for watching this video. Now let's take a quiz on some of the information we have reviewed so far.
You know, I want to say it's got to be this one, because I don't think that they have newer MA. I don't know if they have C-SNPs, and I honestly don't want to scroll all the way up to remember, but I know for sure these two are not correct. Oh, correct. Process of elimination. Alright, let's go. Okay, so what do our guys serve as? I believe it was, all of them, because they are navigators, we saw that. They are supporters, we saw that, and they have to solve the problem. Not about, you know, not helping the client and getting them off the phone as soon as possible. They're all about problem, conflict resolution. I love it. Alright, lesson 3. Coverage area. We got a lot to go, guys. So, you know, if you want to stay with me, but, you know, you don't have to. 8 new states. I believe Hawaii is one of them, so let's go take a look.
We are excited about our expansion for 2023. We are going to be entering 8 new states, offering 127 plans and reaching 25% of Medicare beneficiaries across the U.S. This map of the United States shows our expansion states. The orange-colored states are our existing states, and the purple states are the new states we are entering. We are expanding our states to include Colorado, Oregon, Pennsylvania, North Carolina, South Carolina, Tennessee, Alabama, and Hawaii. In our new states, we will be offering HMO and PPO plans. The portfolio will vary by market. We will also offer dual special needs plans in Alabama and Colorado and a diabetic chronic special needs plan in Tennessee. In our current markets, we are growing as well. We are expanding our service area in Florida, Texas, Ohio, and Arizona. We are introducing a PPO plan to Texas, Ohio, Arizona, and Illinois. We are introducing dual special needs plans in Ohio. We are streamlining our chronic special needs plan offering in Arizona to offer multiple condition plans. And we are expanding our diabetes chronic special needs plan in Texas. In this next section of your training, we will show you each state and which counties we will cover, as well as the product offering for each of those states. Please review your markets carefully.
All right, let's see. All right, Florida, I don't actually sell there. Texas, let's see. We don't have. Oh, here we go. Houston, I'm not. They don't have my county, which is unfortunate, but that's okay. Hopefully they get me next time. I'm in Bell County for those of you who are interested. Bell, like, you know, like ring the bell. Ohio, no license there. Arizona. Oh, I have clients in Maricopa. We shall see. Illinois, North Carolina, Tennessee, Colorado, oh, Boulder, Clear Creek, then Denver. Oh, Hawaii, looks like we only have 2 PPOs. Looks like probably a no premium and a premium PPO in only Honolulu right now. Oh, Oregon, I have a client out in Columbia. It's pretty good. Got a PPO and an HMO and a paid PPO, looks like. Alabama, no clients there. All right, what's next? Lesson 4, plan designs. Looks like they have both MA and MA only. Well, I guess that's everybody, huh? MA only HMOs. Of course, it's the same for everyone. I guess that MA only is only HMOs. Oh, they do have a give back HMO. That must be the MA only. Dual complete. Core HMO, 0 monthly premium with drugs. And looks like you need a referral, so it's not like a POS, point of sale, which some of them are. HMO. Okay. Alright, so that means that the premium part of the HMO is 100% is allocated toward the Part D premium. So if they have a premium and if they have LAS subsidy and they sign up for this plan, their plan premium should be 0. Okay. Essentials give back. This has no Part D and has a give back. And it is an HMO, so for those of you folks who have, clients that are on perhaps the VA or TRICARE, things like of that nature, you probably don't want to sign up for this plan if you have them in the states and counties that you sell in. Right, Liberty, this is a MA only. I thought this was the I already thought this was their D-SNP, but it's not. Okay. And remember, for a lot of, anytime you do Social Security deductions or reductions, it may take up to 3 months. So even if you have someone who's paying their Part C premium from their Social Security, it can take 3 months, which means that they can get blasted one time for 3 months of premium. So always remember that. Devoted Choice PPO. Okay, I was right. 0 Platinum Premium. Okay, they might have relatively okay out-of-network pricing. Flexibility. No referrals required. Alright, 0 PCP, 0 Tier 1, hearing, dental, vision, gym, and more. This might be a good plan. We'll see. Of course, not offered in all markets. Is referring to, where's the asterisk? Not in all markets. Okay, well hopefully we can get, Hawaii will get some of that. Devoted choice. Oh, they do have a PPO that has a give back. Okay, this one I'm assuming has Part D in it. It looks like it's in Austin, Tampa, and South Carolina. Yes, I was right. Plan premium. Okay. Okay, so there is some savings if they have LIF. More supplemental benefits. I'm assuming there's a more boosted dental, vision, and hearing probably. Alright, Hawaii does have this plan, and Oregon. This must be their... Oh, they got diabetes, CHF, and cardiovascular disease. Oh, that's good. So this means that the plan isn't only... this is Arizona, of course, only, but it isn't only going to be a single diagnosis. It's going to be one of these 3 conditions: diabetes, CHF, or cardiovascular disease, and then you can go within the, I guess it makes the HMO a little bit larger, and these are the you could call it qualifying questions to ask. Be Well Plus HMO CSNP. So this is in different counties of Arizona, and it's for the same 3 conditions. This plan does have a premium though, it looks like, so might be a little bit more comprehensive. Alright. Be Well San Antonio is probably the same thing, except this plan is only for diabetes. The HMO CSNP. Diabetes again for Tennessee. Dual SNP, here we go. The D-SNP. Okay, so it looks like some may be able to qualify for it if they're only partially dual. So I guess check the plan for details. Yeah, it looks like it depends on the area. None available in Hawaii yet, though. Alright, that's pretty good. So this is much better looking at it. Kind of a little bit better here. Alright. These are the 2 that are available in Hawaii. Okay. Got an HMO, PPO, D-SNP, C-SNP, HMO only. There we go. Special needs plan. Right, you got an HRA, care plan, care team, care transitions, of course after hospitalization, that should be a no-brainer. Right. Prevention. Okay, that's normal. Which of the following is a main component? Looks like it's all of them. Extra benefits. Alright, let's see what kind of extra stuff they got. Insulin and diabetic supplies. Of course, that's normal. They got the senior, or the insulin $35 program. And it looks like they have Freestyle Libre as their preferred zero copay glucose monitor. Free medical alert. Oh. Competitive dental allowance. OTC. Quarterly like we normally see. And oh look, looks like you can do it in-store at CVS or online. No rollover. It's pretty common. Healthy food card. So this is just things that they have. I'm assuming it's not for all of the plans. Bathroom safety equipment. Wow, that's pretty cool. Member rewards, alright. Visa gift cards. Wow, it looks like they can give Visa gift cards. Usually it's just a regular gift card, like when they have to use like at a vendor, not one that can be really used anywhere. Excluded drug coverage. I guess they cover these things that they normally don't. I'm not sure. But I know these things are normally not covered under original Medicare's both the B12 injections and vitamin D because, well, they're over the counter. And it looks like we got gym membership, a wellness bucks. You can pay out of pocket and they get reimbursed. So I guess if you go ahead and get the item, then you can get reimbursed for it later on. Prescription drug coverage. Alright. I know how to do that. For sure. Alright, go to Devoted. Oh, they're going to show us here. Look up your drugs. Oh, watch this video.
This video will demonstrate how to use our prescription lookup tool. You'll go to devoted.com, click shop for a plan, and then look up your drugs. Once you're here, you'll see the option to either download the drug list, or you can search online. When you choose the search online option, you'll be able to choose your plan here, and then select your state. Once you choose your state, depending on the state, there are multiple plan types that are available with different formularies. You'll have those options up here as well. Then you'll simply start by typing in the name of the drug. As you start typing in the name of the drug, you'll see that they will appear below. You'll also be able to see what tier that they're covered under. You'll be able to see if it's a brand or generic, and any other important information related to that drug. You can even begin to start a list of the drugs that you've looked at for an individual. Also, if you look for prescription drugs that are potentially not covered or have quantity limits associated with them, those will be listed below. And if you see the not covered option, you can also show the covered alternatives. Again, any additional important information will be listed below, and you can continue to start saving a drug list. Once you've created a drug list, you can click on that View Saved Drugs, and you can choose to print and save that as a PDF. Once you navigate away from the page, your saved drugs will be removed. You can also easily change your state, or plan year, or plan type at the top. I hope this helped you learn a little bit more about using our prescription drug lookup tool.
That's very good, actually. A lot of the problem I have with Medicare Center is that they don't allow you to find alternative medications, which makes sense because they don't know which plan you're looking in for this alternative medication. So this would be a good way to find alternative medications and easily switch through plans because, of course, some plans have different medications that they are covering. I wonder if these people have PDP plans available. Well, of course, we know all of those. More on prescription. Let's see.
Let's talk a bit more about prescriptions. It is important when reviewing our plan that you offer to look up a member's prescription drugs to see if they are or are not covered under the plan. Also, during our presentations, we must explain limitations associated with obtaining prescriptions, including prior authorizations, where the member or provider must submit a request for approval from the plan for the prescription to be covered. Step therapy, which encourages the member to try less costly but just as effective drugs before the plan covers another drug. And quantity limits for certain drugs. We limit the amount of the drug that the members can have by limiting how much of a drug they can get each time they fill their prescription. It is also important to explain that exceptions can be made to these limitations based on medical necessity and through approval from the plan. It's important that the prospect understands, and it is part of your presentation, that we will cover a temporary supply of the member's drug during the first 90 days of their membership in the plan if they are new, and during the first 90 days of the calendar year if they were in the plan last year, and we remove the prescription from the formulary. The prescription will be covered one time as a Tier 4 for a 30-day supply drug during this transition. During this time frame, the member can then either change to another drug or ask for an exception. We must also properly explain non-formulary exceptions, which are requests for a drug that is not on the formulary. The member's provider can initiate the request, which is the preferred method. The provider must send in a supporting statement explaining why the member cannot use our formulary alternatives. The member usually has to try or be unable to use 2 formulary alternatives. Members can also initiate the process by calling CVS Caremark, Devoted Health's Pharmacy Benefit Management. If the member initiates the request, CVS Caremark will reach out to the member's prescriber for a supporting statement. If approved, non-formulary drugs will always be covered as a Tier 4 medication. No exceptions. Excluded drugs can never be approved for coverage. For example, cough and cold medicine, vitamins and minerals, cosmetic drugs, drugs for weight loss, non-formulary drugs for sexual dysfunction. There are a couple more exceptions to discuss. The first is tiering exceptions, which is a request for a drug's tier to be lowered. Members may be able to get drugs on higher tiers at a lower tier cost share. Member's provider must provide a supporting statement indicating why lower tier alternatives are inappropriate. Generic drugs can be approved to be covered as low as a Tier 1 or Tier 2 cost share. Brand drugs cannot be approved to be covered at lower than a Tier 3 cost share. Tier 5 medications, non-formulary medications, and drugs with no lower tier alternatives are not eligible for tiering exceptions. The other type of exception is quantity limit exceptions. This is a request for more of a drug than we allow in a certain time period. Member's provider must provide a supporting statement indicating why the member needs more medication than we would normally allow. Let's review a few more facts regarding prescription coverage with Devoted Health. Our members must use all in-network pharmacies. We contract with the big names, but you can verify through the provider lookup tool. Our mail-order pharmacy is CVS Caremark. Members can receive a 100-day supply for Tiers 1 through 4, and some discounts may apply for Tiers 2 and 3 using this option. We do not have preferred pharmacies, meaning the cost share is the same no matter what pharmacy you go to within our network. If a member has a Part D late enrollment penalty, LEP, or income-related monthly adjustment amount, IRNAA, they may pay a higher premium for the prescription inclusion. Lastly, some of our plans do cover excluded drugs including erectile dysfunction drugs, generic brands, folic acid 1 mg tablets, vitamin D 50,000 unit capsules, B12 injections, Finally, our members will receive an explanation of benefits each month, showing their prescription cost utilization. Here's an image of one of the pages of the explanation that simply shows that they have paid and what the plan has paid throughout the month and year. Thank you for watching and learning a little more about how prescriptions work with Devoted Health.
All right, so we now know that yes, that was the a benefit that the excluded drugs like the vitamin B12, vitamin D, huge tablets, and the ED medications are actually covered or included in this one. So LAS, everyone knows about LAS. If you don't, be sure to watch my video about LAS so that you can figure out how to look it up and maybe get your clients some savings.
This video will demonstrate how to use our low-income subsidy grids. You're going to go to devoted.com, and you can access these grids a couple different ways. I'm clicked under the shop for a plan and compare plans, where you can simply put in a zip code, click find a plan, and then under the Prime plan, the charts are right there under the learn what you'll pay. But you can also access these charts for all of our plans if you just go to the member section, the documents and forms, and then click the see benefit and coverage details. Here again, you can put in a zip code, choose the product. I'm just going to choose the Prime as an example. And then if you just scroll on down, you'll see the section that says drug costs with extra help. Once you click into that, you'll see that this is a low-income subsidy grid. So if someone has low-income subsidy, depending on their level, 1, 2, 3, or 4, and the stage of their drug coverage, so deductible, stage 1, initial coverage stage, stage 2, coverage gap, stage 3, and catastrophic, stage 4, you'll know what the cost of a prescription would be determined also by the tier of the prescription. So you can always call our agent support to determine what level of low-income subsidy someone is. And let's say someone is a low-income subsidy level 1. If you're looking at their prescriptions on our lookup tool and you identify that they take a tier 2 prescription, it'll tell you right up here that they won't pay anything until they hit the coverage gap. Starting in the coverage gap, that's when you'll start to see that they'll have the generic cost of $395 or brand cost of $985. Now, if someone is taking a tier 4 prescription, let's say, then it would be determined based on if it's a generic or a brand name drug, what the cost would be. And again, you can see based on each level. So you want to know 1, 2, 3, or 4 to be able to properly use the chart. Down at the bottom here, it does tell you what their premium would be for the plan based on their level of low-income subsidy, 100%, 75%, 50, or 25%. And then if they're 100%, you'll see premium is 0, 75%, 860, so on and so forth. Again, you can determine that by contacting our agent support. And that is how you use the low-income subsidy grids.
Oh, great. So now we can see what the amount of subsidy they get and their copays for every stage, depending on their tier. Excellent. Of course, they have the SSM, that senior savings model for insulin. Wow, for HMO plans in Florida, looks like the insulin's covered at 0. That's pretty good. All right, so during the assessment, they mentioned this. Of course, limitations. Perfect. Perfect. I think it's all of them. Yep, it was. Lesson 8, our network. Right, so the HMO plan, everyone knows what HMO is. You can only go to outside if it's an emergency. Other than that, you have 100% out-of-pocket costs for non-network providers. Referrals are required to see any PCP or see any specialist. And it looks like if you can click there and see if your state has referrals required. Not be required. Oh, look at that. For most services in Ohio, Alabama, North Carolina, Pennsylvania, wow, that's pretty good. So that means that their HMO plans in these states function more like a POS, where you just have to make sure you use a point of service HMO, where you just have to use the providers in the network, but you may not need a referral. Again, for most services, right? So if you're doing a referral, which also has the specialist doing some kind of procedure, you might need a prior authorization for that procedure, which in that case, you would need the referral for that provider. PPO, everyone knows about PPOs. You stay in the network, less cost sharing, more go on network, more cost sharing. There we go. Referral versus authorization. There we go. So referral helps PCPs to coordinate their care. Referrals are required for most specialties on HMO plan. Referrals are automatically approved once the PCC puts them into the availability system. So that basically means that as long as the PCP puts it in the system, it doesn't go through a referral process. Really, just is automatically approved. So make sure you let your PCP know that if you need a referral at the beginning of the year, or that you let your patients know. Authorization. So authorization, yep, PA is like most hated things. They're required, the providers are required to obtain these PAs for certain services that are non-emergent. Scheduled surgeries. Standard authorization is 3 to 14 days. Expedited is 12 to 3 days. 12 hours to 3 days. So you gotta remember that they can delay care this way, right? So be sure to let your members know that We got to go through prior authorizations for, major services. So we can click here, look up the authorization requirements. Let's see what they need. So this is for providers. And I guess these are the information required for the DME. This is all, of course, for doctors, but let's just try check, because I usually like to look at these things. Alright, so it looks like they will allow doctors to take a list here and see all of these items require APA. So you could, if your member had a particular question, MRI, PET scan, right? You're going to need a PA for that. All durable medical equipment, that's a rental over 13 months and more than $750. All these things require APA. So even acute hospital. So what that means is that when you go to the hospital or an ER and you need to get help, they need to admit you, it needs to be authorized first. Oncology and all these other surgeries. So all these things need to go through a prior authorization. Now, I'm sure a lot of these with the spine also have to go through original Medicare's prior authorization as well, but many of the other services won't. So just make sure your client knows that many of these services that need prior authorization will be a small little hiccup for them and their providers when they're getting care. But let's go back to the exam. All right, we looked that up. It's pretty cool. Providers. All right, so it looks like we can choose a plan. Then we can add doctors and specialists. You can search for specialists there, and then, or you can look up the doctors. All right, pretty cool. Choose a PCP. Make sure you use this to verify that they're on the in the network. And if they want to change, they can contact the devoted guided team anytime to request a change. Let's see if they can change it. Oh, it looks like you can do retro. So if a member requests a change on or before the 9th of the month and has not seen their PCP that month, the member may choose to have a change and be retroactive to the 1st of the month or the 1st of the month. So that means they can make the decision. That's good, because I know a lot of times they make a change and it has to happen later, but this gives a small window of time to change, even if they perhaps forgot or something. After the 10th of the month, or if they've already seen, then it'll be effective 1st of the following month. Okay. Now, of course, we encourage preventative care. All right, let's check out the devoted sales process. How to conduct a compliant sales presentation. Of course, we have to do the same as all, but let's see what these 7 steps are. So there's 7 steps, and let's review each one. Just 7. I have like 13 on mine, I think. All right, make sure it's clear your licensed agent, company you work for, does not come off as though you're an employee of Medicare, provide business card, or have some kind of name. All right, this is common things. Talk about the weather, pets, or pictures. Interesting, I've never talked about pictures. Anyhow, let's keep going. Yep, SOA, scope of appointment. Remember, if you have Medicare Center, you can do the scope of appointment on there. Devoted has electronic one, which I would suggest using if you are on, or you're going to be using Devoted, because a lot of times, just like on the other carriers, you need to use their distinct one if you're using the Devoted platform to enroll. For at least 2 other carriers, if you don't have the particular scope of appointment that the company has, you are unable to use the electronic enrollment system. It'll block you. Needs analysis. Oh, here it is, needs analysis. So the needs analysis is very, I've seen this before. So what do you currently have now? What do you enjoy? What would you change? That's the A, it's adjust. What would you adjust in your health plan? Decision maker, do you have any other person that's helping you make this decision? And where are they? Why aren't they here? And then of course the solution, providing a solution or a product, of course, to provide them with this answer that they so desperately require. Next, present the plan. All right, so at the time, just like everyone else, they have a video that you have to show. I would download this video if you do any kind of presentation, so that you have it on your laptop when you are doing enrollments with your clients. And of course, enrollment kit, summary benefits, review the prescription coverage if the plan has prescription, go over the 5 tiers of medication and then the 4 stages, explain the limitations, review the provider directory and choose a PCP if they're in an HMO. If not, make sure you I would put it in anyway, just so that they know that the person they're seeing is not a specialist. Go over the star ratings, etc. So if you are working in a call center, your rules are a little bit different from most agents, because you have to have a CMS compliant sales script. So I'm assuming everyone who's on this, watching this right now, is not a call center, because you'd have your own training, but that's kind of what this is. Finalize the sale. So make sure you ask for, so we can ask for referrals, but you are not allowed. Yeah, here, we're not allowed to request phone numbers. We can only use conventional mail. I am not sure. I thought we could use email, but according to Devoted, you cannot. I would double check that in the CMS marketing guidelines for 2023. But I do recall you could, before anyway, mark it as long as you have an opt-out button on your email, that you can actually send it via email. All right, completing the enrollment, electronic submission, online enrollment tool. That's probably the best way to do it. Once you are appointed, in-person remote signature, paper submission, email or mail-in or fax, probably the least possible way. Oh, look, they do have an HRA bonus, so $50 for completing the HRA. HRA is used to help, help them medication. Oh, look. Look at that. So members also can get some benefit if they join any of the SNP plans and they stay in the plan for that next year. That's pretty good. So remember that now. If you use the portal, it's available immediately. Third-party enrollment vendors, that's Medicare Center. The HRA will be available when Devoted Health processes the applications. You might have to wait, which, again, if that's the case, and you are comfortable using the Devoted tool, which we will go over later on once I get access, because right now I don't have access, I would suggest if you do the HRAs, or you want to do the HRAs, you use the Devoted Health enrollment tool so that you can have instant access. So during your enrollment with the client, you're able to complete the HRA with them right there. So it looks like 1 to 3, they get their text, welcome text. 4 to 7, they receive their member kit, their welcome kit. Day 7, they get asked if they have transition of care, like durable medical equipment items, potentially some pharmacy items, Part D medication that are really important that they need to get transferred right away. And then welcome call. So remember that. They'll get in contact this entire process. They'll get 3 contacts pretty much: the welcome text, the welcome kit, or actually 4, the transition, and then the care transition call from a with the welcome call, all within this time here. Okay, that's the summary. Let's go ahead and, oh look, they can call, and you go ahead and even if they call in to the devoted line, they can switch plans, and the current agent who initially brought them over will remain the agent of record. So that's pretty good. Paper, electronic, just not email, I think. Let's see. Oh, email was correct. All right, so I guess, oh, scope of appointment. I thought it was application. Okay. Take it again. It was all of them. There we go. Submit there. All right. When review is required. So it is not required, I believe. Strongly suggested. Oh, they made it true. Okay, so this is kind of a trick question, I guess, but just remember for devoted, reviewing prescription coverage is a required portion of the devoted enrollment presentation. I guess, oh yes it is. I'm sorry, I made a mistake. I thought this was when you were enrolling a client, but the presentation portion, yes, you have to go through the 5 tiers. If the plan has the senior savings model, which is the insulin program, and the 4 stages of prescription drug coverage. So the deductible, initial coverage stage, coverage gap, and then catastrophic. True or false? Begin has a good alternative to read. No. You need to go through the entire presentation when you're reading, you need to go to the entire summary benefits when you're going through the enrollment presentation. Yeah. What can devoted members expect after enrollment? A welcome text message. Transition needs evidence of coverage. Welcome kit. I'm not sure about these 2 because I didn't see them in the actual little thing, timeline thing that we saw earlier. So let's see. Yep, that's correct. Devoted tools. All right, let's go and check this out. All right, so now we're on to devoted tools. This is lesson 10 here. We're almost there, 10 out of 14, 64% of the way done. So I guess you can go on devoted.com and all the applications and everything is available there like we saw. So we can shop for a plan, look up everything, documents and forms, look up everything without even signing in. So that's a pretty good thing. Let's see, download your Medicare guide. I guess if I do this, they're going to start sending me some, yeah, I guess they're going to send me all kinds of stuff. So you know what? I am just going to, oh God, I got to put my phone number. They're going to call me. Oh, they need my phone number. So you know what? I am not going to do it. Hopefully they can just mail it to me instead or email it to me. Let's watch the video. Like I jumped the gun. And as you know, I don't listen to things.
This video will demonstrate how to use the devoted.com website. Now, I'm not going to go through every single tab here, but just going to show you a couple different things that you can utilize, maybe some areas that you weren't aware are available. So first, just going here on the shop for a plan section, this is where you can easily go to compare plans, put in a zip code, select whether or not they have Medicaid in certain areas, and click find a plan. And you can also easily access summary benefits or LAS charts for the prime or select plans. Also under the shop for a plan, you can find the doctor lookup tool, the drug lookup tool, as well as the extras and just a little bit more information around some of those different extra benefits. Up at the top under the members section, there's this documents and forms section. Here you can easily just see benefit and coverage details again, put a zip code in, a plan year, choose your plan, so choose our core plan here, and see all the plan documents there, including what you know about your plans, which is a great tool to include information about medical benefits, dental, extras. If the plan has comprehensive dental, it also has all the different dental codes at the end. Just going back here as well, a few other things you'll find in this section. This is summary benefits, over-the-counter catalog, more about devoted dollars, the EOC, annual notice of change if applicable, these great LAS drug costs with extra upgrades, more about what requires prior authorization, who requires a referral, and our durable medical equipment brands that we cover, and if applicable, our star ratings in that area. Also under this member section, under that documents and forms, you can also find different forms here, such as our appointing a representative or release of PHI forms, HRA forms, our reimbursement forms. The HRAs for agents, again, you want to do that in the agent portal. It's enrollment forms as well. Under this member section here as well, there's more just information about like health and wellness, including healthy tips, what benefits are available or free programs are available to them, some articles. This About Us section has great information around our story, our mission, a little bit more about our team, our executive team here, and then more information around how people can contact us. If you ever want to just go back to the homepage, you can always just click the heart, and that'll always take you home. On the right-hand side here, you can find more information for our providers here. Just click into a state, you can find quick reference guides, manuals, again, OTC catalogs, referral lists. And the For Brokers section has more information here as well for our broker agents, and you'll find the most information right in your agent portal as well. Again, home will always take you home, and you can always translate the preferred language here if you want to change it to Spanish or back to English. And that's just a little bit about how to use our website.
All right, so it looks like you can do everything like they said through this devoted site without even logging in. Get important information. That's really good that they have the dental codes down there. So let's try to take a look. Where was that? Learn about extras. Dental. No, there's something else. They got silver sneakers. That's good. Wellness bucks. I guess we have to find a plan near me. So let's go find a plan near. Gosh, I actually don't know what any Texas zip code is, so I probably won't be able to find. Let's go find Austin zip code. $78701. Let's see if that works. 78701. Find a plan. Nothing. Oh yeah, that's right. They're new to this area. So let's see if I can. They actually probably won't let me look for anyone. Let's try San Antonio maybe. Let's try 78201. Alright, so summary of benefits are there. Let's see if we can find maybe those documents. $78201. Ah yes, here it was. So this is where everything is. So remember that, everyone. It's members, documents, and forms, and then you look there. That makes more sense. I don't know what I was thinking. But where is the what to know about your plan? She said something about the dental benefits. Well, 3,500. I thought she said they'd give us the dental codes that are required, but I guess they don't. Wow, so it looks like if the dental works this way in other counties, you don't need to even have. There's no copay. There's no like 50% coinsurance. It's one root canal, one crown is 100% covered. That is quite amazing. That's the way that it's gonna work. Unfortunately, they don't tell you what the codes are. Not in this one. Let's see if there's another healthy prudent summary of the counter devoted evidence of coverage, referrals. So let's see if in this they have the dental benefits in here. I doubt they do. They normally don't. Medicare dental. All right, here we go. At the end of this chart for details. Okay, these are all. Where's the end of the chart? Here we go. So the dental services, all right, they have it all in the evidence of coverage. So in the evidence of coverage, they'll have all the dental codes that they cover. And this is probably the best place to find it. X-ray, zero copay, all the comprehensive dental benefits are all here. All right, so that's pretty good. Take a gander at this later on. All right, so back to the exam. We don't have access to this yet, so I won't be able to take us through that, but hopefully they have a video. Ooh, there's something here. This is nice. Marketing portal. Ooh. Okay, wait. So after 48 hours after we get the ready to sell email, then we will get a registration code to do this. Until then, I guess not. Customizable flyers, that's nice. Customizable postcard, that's nice. Swag is nice. Of course, if they paid for it, that'd be even nicer, but you know, probably just buy it. This is pretty cool. All right, looks like we have some interesting things here. And Devoted.com. Oh, and the agent wall. I mean, honestly, Devoted.com and the agent portal submit. There we go. All right. Yeah, I don't think we have to pay for these. Yeah. Zero cost for the for the kits. Events. Oh gosh. So view this website for all the marketing guidelines. This is ridiculous. These things are so long. I know because I've tried to read this, and yes, I read it a few times, but it is very difficult to understand. It's like, just be safe. Just if it seems like it can be construed in any way of being wrong, it probably is. So here we go. So gotta register. So 14 days in advance for formal events, 7 days in advance for informal or education, agent portal, events tab, or by, I guess we must have a local community outreach specialist, which I assume for those of you in Hawaii will be Kaili Hombo. And let's see, we'll request your email 2 to 3 business days. Cannot conduct, of course. So if you do at least 14 days, try much more in advance, because you will have to secure the venue location, and you don't really want to secure the venue location if you're not approved to do the event. Of course, you have to be licensed, appointed, and have the ready to sell email. 72-hour notice. Okay, so 72-hour notice if you cannot make the event that you are registered for, and this looks like what it is. So you click on the add events, you submit the new event via this event here, and then review as is means, I guess they're thinking about it still. Okay, make sure you have all the marketing equipment you need. You can order stuff from here, I'm assuming, once you have your login, because it probably won't work for me because I don't have a ready to sell email yet. And I'm assuming all of these things are available. Everyone knows, be early, set up early, dress to impress, have your ID on at all times, and if you can, bring beverages and snacks. That'd be fun. Alright, reminders in the event, Devoted Health Events. This is, I guess, the table and what you can display. It's non-specific. So even if you are just, I guess if you're showing Devoted items, and you can have many, like, I guess that, like, if you folks do Walmarts and fairs and you have multiple carriers that you're showing, make sure you show both. Or you register both or all three. Okay, if there's an emergency, immediately contact them. And do not just leave or don't show up. Make sure you let them know. Yep, make sure it's providing contact information is optional, they're not supposed to. If there's no attendees after 15 minutes of the start, you can let someone at the work location, like if you're over at a YMCA or if you're at some kind of a community center, let the organizing person or the front desk person know that no one is there right now, and you're going to just go ahead and go home and leave your business card for people who come perhaps too late. All right, let's try this now. Wow, if you can get this many people in the room, that'd be amazing. Start on time, have a projector or screen. Yep. So for those of you folks who haven't already been to one of these or done one of these, because it's been like 3 years since we've been able to actually have formal presentations in any kind of actual presentation room, each desk needs to have an enrollment kit, pen, paper, your business card, potentially a scope of appointment, and everything inside the enrollment kits. And then make sure when just practice standard presentation protocols. Introduce yourself when people come in. Before you start, make sure you spit out all your disclosures. You're not an employee of Medicare. You are licensed and appointed to the insurance company you're representing at this thing. And if you're a broker, you can say, I work with XYZ brokerage company. We are a brokerage, which means this is just one of the many products that I offer. But in today's presentation, I can only speak about this one particular plan. If you have interest in other plans, you need to contact me after the presentation is formally over. La 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 la. All right. Yes, of course, telephones. I just recently came from the movie theater a couple days ago, so make sure you have your phone silence at all times. Let them know where the bathrooms are, etc., etc. During the presentation, you have to show the sales video, of course, and that, it looks like they have to tell you it's not a Medicare supplement plan, which I'm assuming most people would know. All that looked at, yep. So multiple plans. If you need to speak with each individual, you can use other plans options as needed. Oh yes, keep the audience engaged. So a lot of times people fall asleep. This can be a very boring presentation, just like watching me take this test or watching me go through this training. Ask questions. They're there. First time in a long time you can actually see somebody, talk face to face with them. Keep it interesting. Like if they have a give back, what would you do with the money? If you could save money from paying an expensive premium, what would you do with that money? Those kinds of things. Ask about if they know HMO, PPO differences, PAs, all those kind of things, so that you can at least keep them kind of engaged with like a lot of the jargon or definitions of the plans, or of medical anyway. Finishing up the formal sales presentation. So remember that if you're doing these and you have someone who is ready to enroll, do have them enroll. Like if they want to, go ahead. That is the primary purpose of these presentations. If they want to enroll, they can enroll. And if they don't, if they have more questions, then now is the perfect time to schedule an appointment with you, either right now at this time, or go on to schedule them if they're available right after this presentation, because they themselves maybe are willing to hang back and be the one that meets with you. Then of course do everything you need to do, scope of appointment, etc., etc. After the event, reach out, let them know how many people were there, any sales, etc., because that kind of keeps them happily engaged and happily reporting to their upper lines. All right, so marketing, sales, events. These are things that you can and cannot do. And remember, this is actually a event that is designed to steer enrollees toward a plan. So you're actually promoting this plan essentially. And this is something you can only do during sales marketing events, which are registered by CMS, or if you have an in-home appointment with someone. So you can, of course, provide the marketing marketing materials, use sign-in sheets as long as they're clearly labeled. It's optional. Conduct raffles, provide light snacks, and provide nominal gifts to attendees with no obligation to enroll, 15 or less, remember? Now, you cannot use any sales or talking points that are not approved by Devoted and CMS. No health screenings. No required sign-in sheets. Make unsubstantiated statements. So you can't say this is the best plan. You can say this is a 4.5 star rated plan. We have a 4.5 star in customer service, a 4.5 star in, pharmacy benefits or whatever. You cannot have a meal, and you can't market non-health related products. You can't be selling life insurance or annuities in this presentation. Educational events. So educational events are far more lenient, but of course you can't do a lot of things as well. You can't do anything when it comes to marketing. So you can't market anything, distribute marketing materials, have any plan application displayed or distributed there, or accept any there. But what you can do is you can have educational meetings with Medicare beneficiaries. And after the educational event, you can have a sales meeting, but that's only after, not during. You can talk about Medicare Advantage. You can talk about Medicare Supplement. You can talk about Medicare Part D. You can distribute any kind of educational materials. You can set up future personal marketing appointments. You can, of course, do all these things. You can even have a scope of appointment. You can provide meals, but only if the event is an educational event. Okay. Also, what I've heard a lot of people do is they'll conduct a educational event, and then immediately following that, they'll conduct a marketing event. Now, I, for one, don't like to do this. I actually don't like to do any formal presentations at all, simply because I do most of mine, as many of you who are watching this, via telephone, and I mostly do Medicare Supplement plan. So it's not something that I'm big into, but if that's something that you folks want to do, something you can do. And we're going to have to answer questions about it, so be ready to. There we go. Look at how many of them must register for informal, form, or educational event. 7. That's for informal or educational events. So remember, informal was the least amount of days. Well, still about 7 days. All right, so let's go again. When hosting a Devoted event, agents are not required to use Devoted. That is false. Obviously. During marketing events, agent may conduct raffles during which individuals can include their contact information. Like information for that purpose only, and prizes are. So I think so. I remember collecting this kind of information for that. There we go. Yep, it's true. So you can do raffles. Compliance metrics and review. We're almost there. 12 out of 14. Almost 80% there. Yep, remember, agents are not permitted to do any marketing really for the plans during the first 15 or from the 1st to the 14th. You are able to talk to clients about benefits, but you cannot collect applications. Rapid disenrollment means that they disenroll within 3 months of the plan acceptance. That would be a 100% commission reversal. And if you have a 7, okay, so if you, wow, so if you have more than 20 enrollment applications for January 1st and greater than 7%, so that means 8% of 20 is 4, no, 8% of 20 is, well, why can't my brain do this? Like 3? No, it's like 2, less than 2. I guess if it's 2, greater than 7% would be 2. So if 2 people who rapidly disenroll, then you will be reviewed. So make sure you don't do that. For the rest of the year, include the OEP, disenrollments, or 10 or more applications. So if you are, okay, so I guess it's an or. Now this one's an and, but this one's an or. So devoted, this is greater than 7% if an agent has 10 or more applications. So if you have 10 or more applications, if you're less than if you're less than 10 applications, and they won't give you a review. If you have 20 or less in AAP, they won't give you a review. But if you have more than 20 and you have a greater than 7% rapid disenrollment, you will be reviewed. Okay. All right. So you must submit within 3 days of receipt. So use the online electronic if possible. So if someone has a case against you, founded, unfounded, inconclusive, please make sure you are doing what's best for your client at all times, and make sure the client knows exactly what you're doing for them and exactly what they are doing when it comes into enrolling. Permission to contact. Everyone should know all of these things, okay? So you can make unsolicited contact through conventional mail and print media, there we go, or email, provided you have an opt-out option. So you can send an email without receiving a request for contact, so to speak. If you have a pre-scheduled appointment with a potential enroll who's a no-show, they may leave information at that potential enrollee's residence. You can call individuals to give you permission. Again, the permission is limited, and it's only to the entity from which the individual requested contact for the duration of the topic of that transaction. So you can't use request for permission, request for contact cards from like last year. I believe it's like usually 3 to 6 months is the viability. And of course, if you've already contacted them about, let's say, their OEP for last year, you cannot contact them again for their AEP of this year unless they have explicitly sent you another permission to contact form. Call current enrollees, including those in non-Medicare products, to discuss Medicare products. So here is a misconception. So you are not supposed to call enrollees to discuss Medicare products. So your current enrollees, so your current clients. You can call to see how they're doing. And you can ask them if they have any questions about 2023. But you are not supposed to call them and say that you want to discuss Medicare products unless they contact you. Okay? Actually, I misread that. You can. You can call current enrollees. Wow. Here I was thinking I've been doing this wrong the whole time, but in actuality, you can call, including those in non-Medicare products. So here's the thing. Okay, so if you have a client who bought, let's say, I don't know, a cancer plan from you or a dental plan from you, you are able to call them and discuss Medicare products because there's an existing relationship. I believe it falls under the existing relationship clause where they know that you are a sales agent and that you make money via sales, so they have no reason to assume that you are doing or discussing Medicare products on, behalf of the federal government. Okay, so you're also able to call beneficiaries, submit enrollment application to conduct business related to enrollment. So I'm assuming this means if you have a client who submits an enrollment application for like dental, you're able to call them, which is kind of unfair because that means that it opens up the devoted insurance agents to call, because sometimes, like I know for Humana dental insurance, they can collect the application, which means that now the in-house agent could potentially steal your client. But that's just something we have to deal with. So be very, very cautious of how your clients are doing anything. So you can't do door-to-door solicitations. You can't leave flyers at people's house. You cannot approach enrollees in common areas. They have to be the one to approach you. You can't send DMs, direct messages, to people who find you unless they call you first. You can't use telephone solicitation, cold calling. You can't mass send voicemail messages or text messages. You can't market plans prior to October 1st. And you can't make unsolicited calls about other business in means to generate leads for Medicare, the bait and switch. What this means is you can't be calling people about, let's say, final expense, and then say, hey, by the way, AEP is right around the corner. Do you think now might be, I also do Medicare, you think now might be a good time to talk about Medicare? No, you can't do that. You can only talk about Medicare if they want, number one, ask you, because let's say you have like a business card that says you do Medicare, and they're seeing you and you're making calls to do final expense. That's an okay thing, because then they fall upon this one. But if you call someone and say, hey, we do dental, we would like to talk to you about how we can provide you with dental insurance that maybe your Medicare plan doesn't. And then you then switch the conversation, say, or if you want, I can talk to you about dental programs that Medicare Advantage plans that you can enroll in, will offer for next year. That is a bait and switch. That is not acceptable. So make sure that if you do talk to someone about dental or anything that a Medicare plan might have, you make the distinction between the two. So if you call someone, make an appointment, or you talk to them about dental, they do not ask you about Medicare, you do not switch them or talk about Medicare. You can imply, I guess, but you're not supposed to. You could ask them about their current dental coverage, and if their current dental coverage tends to be a Humana's dental rider or whatever, and they, for whatever reason, ask you about your Medicare plans, you can then switch and say, well, I am a Medicare agent, but I'm here to talk about dental. If you want me to talk about Medicare plans, I have to have you sign a scope of appointment, because this meeting was generated from, me coming over to talk to you about dental, not for Medicare. So I have to make that distinction. If you do that, then it's A-okay. But if you don't, and I know it's going to be really gray because a lot of people won't remember this conversation they have with their agent. So it's very important that when you have a client who is new to you, you make very, very strong official guidelines for them to kind of follow, so that they know that you're working in a highly regulated space, which it should be, and that you're doing what's best for them, Outbound calls based on referrals. So yes, you cannot call referrals. You can have a referral call you, but you cannot ask for one or your numbers to call them. So people who disenrolled, you cannot call a disenrolled member. Or if you see someone who is currently going to voluntarily disenroll, you can't call them to quote unquote stop the bleeding. Call beneficiaries to attend sales events unless the beneficiary give express permission. So yes, you cannot call, even if you have a sign-in sheet, unless a sign-in sheet says that you will be contacted later on and there's an explicit or documentation of the permission to be contacted there. You cannot call prospective enrollees to confirm receipt of mailed information. So if, for example, a client calls you and says that they want to get information about so-and-so plan, and you mail it to them, unless you get explicit permission to call them after they received it, either via a recorded line or something, you are not supposed to call the prospective enrollee to confirm that they received the information that you mailed them. Okay? So this is a good one. Contacting current clients and or members. You may contact your current clients from another business relationship with whom you have a current active contract or business relationship in other products. You may also be able to provide proof of current active relationship with the client upon request. So there we go. That's how they're going to solidify it. So if you are someone who is selling, let's say, final expense, dental insurance, ACA plans, you may have to have a proof of current active relationship with this client in order for you to bypass the kind of cold calling or bait and switch rules. If you're the agent of record, you may contact Devoted Health Plan member to discuss the plan which member is currently enrolled without obtaining PTC, of course. So if you are talking to someone and you want to discuss the plan they're currently in, you don't have to You don't need a permission to contact. They're your own clients. If you are not the AR, you may only call an existing member if permission to contact has been delegated by Devoted Health Plan to the agent. So that means that if they're like a house account and Devoted provides you with their contact information to contact this member, then that's okay. But if not, you cannot. Now, you may only use the member's protected health information, or PII, to the extent necessary to conduct business on behalf of Devoted. This is pretty much saying that you're probably never going to get into a situation, but if there are, like, I don't know, if there could be house accounts, then you would be able to get information via Devoted, but only to the extent in which necessary to conduct business on behalf of Devoted. Reporting fraud waste, so there's the hotlines you can call, and of course you can send to either the email and compliance or the compliance officer with Devoted. Next. Oh, look at that. Select all, local sales manager, compliance, and the hotline. All of them. 7%. Cannot do this either. Take the application with them and take the application with them and mail it on behalf of the member on. Huh. I, for one, do not do any marketing at all during this period, so I honestly don't remember. But I'm pretty sure these two are almost the same. Remind them to sign an email application Devoted. This one sounds like you can do it. This one sounds like it's extremely fraudulent, because they mean it would already have to have been signed. Yeah. So it looks like you can help them fill out the application. You can have them fill out the application without the date and signature. And you can remind the prospect to sign and mail the application on Devoted on or after, which I guess makes sense. Resources. Devoted Health Agent Portal, Devoted Broker Site, Summary Benefits EOC, provided to, alright, all those things are pretty self-explanatory. Sorry, my mouse is really bad. It keeps clicking back upwards. It just does that all the time. Let's see what Laura has to say.
We hope you have enjoyed the information we have provided in this training presentation. Once you close this training, you will be directed to take an exam. Once you open the exam, you must complete the questions at that time. To complete your certification, you must pass the exam with a score of 85% or higher. Thank you for choosing to represent Devoted Health. Happy selling and best of luck for a great year.
Alright, let's go and do this. Where is the... Okay, 100% complete. So, what do I do now? How do I get out of here? Back? Nope. Well, let's just X this out and go to certification exam. Continue to exam. Start exam. I have a total of 3 attempts. Oh boy. I will receive, hopefully in 48 hours, the ready to sell email. Well, I guess that's appointments up here, so it's gonna be... Alright, so 5 to 10 business days to complete the process. Hopefully we get it soon. Alright, that was it. Enjoy. Oh, and by the way, the test questions were pretty much exactly the same as the questions that we went through during the practice. Very similar there, so if you went through the practice and kind of remember all the questions, you should get it pretty quickly. There are some tricky ones, but just read all the answers before going. Alright, good luck.